Hello, I'm David Kerr, Professor of Cancer Medicine at the University of Oxford. Today I'd like to talk a little about a paper that I read recently in the British Medical Journal Global edition. One of the senior co-authors, Professor Ala Alwan, is a dear friend. He's had a distinguished career as a public health expert, having served as one of the Deputy Director Generals of WHO and as the former Minister of Health and of Education, actually, in his home country of Iraq. So somebody who has health policy experience at the very highest level. He and a group of colleagues have come together to recommend a package of care for low and middle income countries who are emerging from the travails of the COVID pandemic. So as these countries seek to repair their economies, as they seek to get health back in the front foot, these experts have recommended a series of high impact health measures, 120 of them across all of medicine, that should be the basis for rebuilding health infrastructure. The process that they undertook to go through these is one that's been well validated by WHO in the past, but the things that they consider, the maxims, the principles underpinning their recommendations are treating people equally, avoiding any form of discrimination, maximising the benefits produced by scarce resources in low and middle income countries, i.e., saving the most individual lives or the greatest number of life years by giving priority to patients likely to survive longest after treatment. So, focusing on those who are likely to benefit most. And finally, giving priority to the worst off in terms of poverty or in terms of health. The sickest are those who will have lived the shortest lives if they die untreated. So these principles, of course, can be merged with other goals, macroeconomic, they can be shaped by the health policy framework within individual countries. But I think it's a really important route map, a guide for recovery of health. And for those wealthier nations who have overseas aid programs and so on, it gives them potentially a focus of, not of intervention, but a focus of support, so that they can actually work with those countries to see what they can pull together. I thought you'd be interested to see what, again, as I say, this is across the spectrum of all of medicine, but to see what the recommended, the sort of best buys were, if you like, for cancer. These are the human papillomavirus vaccine, early detection of cancer symptoms. We know that, as I've said many times before, that the burden of presentational cancer in low and middle income countries is always much, much higher. The fraction of stage 4 patients much greater in those countries than in those wealthier countries in the north and in the west. Early detection and treatment of early stage cervical cancer. We know this is still the commonest cancer of women in low income countries. Breast cancer is catching up, but cervical cancer is a terribly important problem. Treatment of early stage breast cancer using multimodal approaches, including generic chemotherapy with curative intent. Treatment of early stage colorectal cancer, again, multidisciplinary approaches, including generic chemotherapy, again, focusing on those with curative intent. And treatment of early stage childhood cancers, Burkitt's, Hodgkin's lymphoma, lymphoblastic leukemia, retinoblastoma, Wilms tumour, all treated with curative intent. And of course, we would include within that sort of subset of chemocurable adult tumours, the teratomas, the rarer dysgerminomas of ovary and so on. I think this is a nice piece of work. I think it's an important piece of work because it does help to guide the international community in supporting our brothers and sisters in low and middle income countries as they emerge from the pandemic with their health services tattered, frayed, their economies not functioning. So a clear base on which to start to rebuild those health economies. I'd be really interested in your comments. do you feel it's too direct of approach? Do you think that these sorts of guiding principles, these frameworks, are useful at all? I'd be terribly interested. But for the time being, thanks for listening as always, Medscapers. Over and out. Thank you.